What does atrial fibrillation feel like? 7 patient stories. Created by UPOlife. Atrial fibrillation, also called AF, is the most prevalent cardiovascular disorder that throws the heart rhythm off balance. It occurs when the electrical signals of the cardiovascular system start to muddle and mess with normal heart functions. A lot of people wonder what AF feels like. The truth is that it is different for everyone. That's why it's important to take a look at other experiences and learn more about the condition. For most patients, the condition causes a faster heartbeat. This is why people feel thumping or thudding in chests. Other patients may experience fluttering, palpitations, chest pain, and sweating. In other cases, the pulse becomes weak or erratic and causes dizziness, exhaustion, and weakness. Here is how various patients experience the condition for the first time. 1. Shortness of breath. Bill McKee, a financial planner in his late 60s, was diagnosed with AF in 2016. He expected to experience heart problems because they ran in the family. When he got diagnosed, the nurses noticed quickened heart rate. It was 166 beats per minute, but he didn't feel anything. The only thing he did notice was the lack of breath. 2. Racing heart rate. For Jimmy McFarland, a 43-year-old patient, the experience was completely different. He had a quickened heart rate since he was a teenager, which made the condition difficult to detect. In his 30s, he started experiencing episodes from time to time. Eventually, they got worse and lasted for months. He struggled with erratic heart rate and unpredictable episodes. 3. Persistent chest pain and trouble breathing. Some patients may experience worse symptoms than others. That was the case with Dr. John Mondrola. Although his first episodes were bearable, with time, he started experiencing unrelenting pain in the ribs and chest that made breathing incredibly difficult. Further, the episodes got worse, leading to increased body heat, dizziness, sweating, and blurry vision. 4. Feeling a little off. Mellisa Duncan had an unusual experience. Instead of the typical chest pain or lack of breath, she just felt a little off. Her anxiety started kicking in, and she felt sick to her stomach. Later, the blood pressure started dropping, which was a red flag. 5. No signs at all. For certain individuals, AF doesn't cause any obvious signs. That was the case with Rosalie Linver Ungar. Since her family had a history of heart issues, she believed herself to be a candidate. She got an appointment for a checkup and ended up getting diagnosed with AF. 6. Regular heart flips and lack of energy. Over 7 years ago, Victor Lance got diagnosed with AF. He was an active Marine, but the condition started dragging him down. For Victor, the signs were evident. The quickened heart rate, chaotic rhythm, and improper heart function made it difficult for him to lead an active life. 7. Constant fast heartbeat. Deniss was already experiencing AF for an entire month when he got diagnosed. He measured 150 to 180 heartbeats per minute for a couple of weeks. He had to receive urgent medication, but he struggled to find the right treatment. Eventually, doctors got the condition under control. Conclusion. AF is different for everyone. If you don't experience symptoms, but believe to be a candidate for heart conditions, it is best to book a doctor's appointment. Getting ahead of the condition should be your top priority. Learn more about how to evaluate your heart health and manage your heart condition at home by visiting UPOlife.com.